All right, sir. Please start. We are live now.
Good evening to all. This is Chandra Mohan, Ortho and Sports Physiotherapist from Dindivanam, Sri Samraj Physiotherapy Center. A warm welcome to all the participants for this For the Students, by the Students webinar series. And today is our second day. And I welcome our ExRx team members first, Dr. Rupesh and Professor Duna Saha. And I also thank to our associations, Fecal Studio, Physioactive, Thairam Academy, and User Creations, and Sri Samraj Health Services Private Limited. Today's first session topic is techniques for bronchial hygiene. Will be presented by Dr. Prachi Buch, MPT cardio student from Dr. D.Y. Patil College of Physiotherapy, Pune. I request and welcome Dr. Prachi Buch to take her session.
Yes, thank you so much, sir, for the introduction. Ma'am, shall I start screen sharing?
Please start your screen sharing. Yeah, okay. Screen is visible. You please start, okay?
Okay. Hello, everyone. So our today's topic is techniques for bronchial hygiene, from traditional hands-on technique to modern technological approaches. So everyone knows about what is the basic anatomy of the respiratory system. So I'll just revise it. It is divided into two parts: upper respiratory tract and lower respiratory tract. Lower is more important as it consists of lungs. The upper respiratory tract is below the vocal cords here. If you can see my cursor, above the vocal cords it's upper respiratory tract, and below the vocal cords it's lower respiratory tract. Now we'll see what is bronchial hygiene. So basically, bronchial hygiene is formally referred to as pulmonary toilet. So it's any technique or procedure utilized to maintain lung sterility by loosening or removal of retained secretions. So the purpose of this bronchial hygiene technique is to improve the clearance of secretions, increase lung volumes, maintain airways, and warm humidity, aiming at enhancing ventilation and gas exchange. So BHT basically involves the use of non-invasive airway clearance techniques. So respiratory health, that is pulmonary hygiene, depends on consistent clearance of airway secretions. Normal airway clearance is accomplished by two important mechanisms, that is mucociliary clearance system and the ability to cough. Impaired mucociliary clearance is linked to poor lung function in a broad range of disease and disabilities. So what all comes under BHT? So chest physiotherapy, that is postural drainage, autogenic drainage, percussion, vibration, coughing and suctioning, that all. Breathing exercises, that is huffing, different types of breathing, diaphragmatic, pursed lip and glossopharyngeal. Then manual hyperventilation, that is used in intubated patients, and respiratory devices such as spirometer, flutter, Acapella, aerobica, RC cornet, etc. So now we'll look at the indications. So what are the indications? So why it is used? It's used to prevent respiratory complications. It's used to treat pulmonary infections. Excessive sputum production. So what is now excessive sputum production? So most of the authors referring to articles, they say that 25 to 30 ml per day is excessive. That is 1/4 of a cup or 12 teaspoons is excessive. Then see, excessive sputum production is seen in pathologies like cystic fibrosis, bronchitis, that's COPD, bronchiectasis. So in these conditions, BHT is used. Ineffective cough, maybe due to weakness, pain, or placement of an artificial airway. Then there are two more uses, prophylactic and therapeutic. So what is prophylactic? That is preoperative high-risk surgical patients or post-operative patient who is unable to mobilize secretions. and neuro patients also who are unable to cough effectively. They all come under prophylactic. What is therapeutic? So therapeutic is atelectasis, then musculoskeletal deformity patients, patients who have abnormal breathing pattern, they all come under therapeutic. So these are the few indications where we give bronchial hygiene technique. So looking at the contraindications. So elevated intracranial pressure, acute and unstable head, neck or spine injury, increased risk of aspiration, cardiac instability, pulmonary embolism, pulmonary edema associated with congestive heart failure. So these are the contraindications where you don't give any type of bronchial hygiene techniques. So now, what are the goals? So there are short-term goals and long-term goals. So what are the short-term goals? It removes obstructions, reduces work of breathing, improves delivery of mechanical ventilation, improves gaseous exchange, preventing and resolving respiratory complications, facilitating early weaning from ventilator. And what are the long-term goals? They are prevent postural deformities, improve exercise tolerance, return to optimal function, promote relaxation. So these are the goals. Now, what precautions do we need to take while delivering BHT? So we have to look for sutures and ID. We do not give on sutures or ICDs. uh, Unstable vitals, acute myocardial infarction. Immediately after tube feedings, we are not supposed to treat patient for at least half an hour. Untreated tension pneumothorax, head injury with raised ICP. If the ICP is normal, we can treat the patient. Abnormal coagulation profile, untreated tension pneumothorax, status epileptic. Status if the patient is having seizures, so then we cannot give status asthmatic. Status when it's severe asthma and the patient is not even responding to the bronchodilators, we do not give any type of exercise. Osteoporotic bones. So these are the precautions we need to take. Now moving on to the methods. So there are two methods, two types of methods, three traditional methods and modern methods. So the three traditional methods are directed cuff, postural drainage, and external manipulation of thorax, which we refer to as percussion, vibration, and shaking, which everyone must be well known. And the modern methods, these are breathing exercises. They include ACBT, autogenic drainage, and the exercises, manual hyperinflation, and the high frequency chest wall oscillatory device. That is the West, which is nowadays used in most of the ICU settings. The positive airway pressure therapy that includes CPAP, EPAP, and PEP therapy, which includes all the devices and suctioning. So starting with the traditional methods, we are first going to look at the cuff. So directed cuff. So it's one of the simplest techniques to employ. So cuffing is a forced expiratory technique performed with closed glottis. So it removes secretion from larger airways. Everyone, so see nowadays all the students are confused between what is cuffing and what is huffing. So if you look at me, I'll just perform a cuff and then I'll perform a huff. See, when you perform cuff, you don't, your mouth is closed. And when you perform huff, your glottis is open. Like, so huff is performed with open glottis. It removes secretions from distal airways. So coughing removes secretion from larger airways, and huffing, it removes secretion from distal airways. The third is sniffing. It's an inspiratory maneuver performed after full inspiration or expiration. It augments collateral ventilation, thereby preventing distal airway collapse. Sniffing is just like this. You inspire. Yes. Next, we'll look at the postural drainage. So it's a passive technique in which patient is placed in different positions to facilitate the removal of secretions with assistance of gravity. So it enhances mucociliary clearance, reduces work of breathing, increases lung volumes, optimizes oxygen transport by improving ventilation percussion mismatch. So here in the diagram, you can see I have mentioned the different positions. So here the right superior lobe, that here B1, B2 and B3. B1 represents apical segments, B2 B2 represents anterior segments, and B3 represents posterior segments. So there are different positions in which the secretions can be drained. Now looking at the external manipulation of thorax. As I told, it's commonly known as chest percussion and chest vibration. It also includes rib shaking or rib springing. So chest percussion, it consists of rhythmic clapping on chest with loose and cupped hands. It dislodges the loosened secretions from the lungs. So basically, here I'll show first picture. You can see of percussion. Here what the main precaution should be taken is, here you should have, your nails should be cut, no jewelry should be worn, and no watches. Now the chest vibrations. It consists of fine oscillations of hand directed inwards against the chest, performed on exhalation after deep inhalation. It helps in moving loosened mucus plugs towards larger airways. So it's performed with both the hands, basically this, and then you perform on the patient. um, what is now shaking or rib springing? It's a coarser movement in which chest wall is rhythmically compressed. It's different from vibrations. So shaking has a more oscillatory movement rather than vibrations. It directs secretions or larger airways towards and airways and stimulates cough. So now we have looked at the traditional techniques. We'll look at the modern methods. So if you see at the modern methods, each method is very long, and therefore we are just going to see every method in brief. So looking at the breathing techniques, it is a technique which concentrates on ventilation to specific areas of lungs. There are mainly 4 types of breathing exercises, that is diaphragmatic breathing, pursed lip breathing, glossopharyngeal breathing, and segmental breathing, which is also known as coastal expansion exercise. And it has 3 different types of expansion under it, that is apical breathing, lateral coastal expansion, and posterior basal expansion. Now, all these breathing have different types of indications. So, in different conditions, you give different types of breathing exercises. Uh, for example, in post-operative patient, we usually give diaphragmatic and pursed lip breathing first. So, different types of breathing have different indications. Now looking at the ACBT and autogenic drainage. So active cycle of breathing technique, it combines different breathing techniques that help clear mucus from lungs. So ACBT consists of 3 main phases: breathing control, deep breathing exercises or thoracic expansion exercises, huffing or forced expiratory technique, that is FET. So after, there are cycles. So once the patient gets adapted to it, you can increase the breathing control, deep breathing, thoracic expansion, and accordingly. The sets of cycles can be adjusted accordingly. Now the autogenic drainage. It is a technique that uses large breath out to lose mucus in lungs. That is, so AD is basically self-drainage. It has 3 phases: unstick, collect, and evacuate, where the patient first breathes in low volumes. That is, that's a shallow breath. Then the patient breathes in the medium volume. That is the um, more depth breath. And then in last, the evacuate phase, the patient breathes deeply, and then it's followed by a huff or a cough. So now looking at the manual hyperinflation, it was originally defined as inflating lungs with oxygen and manual compression to a tidal volume of 1 liter, requiring a peak inspiratory pressure of between 20 and 40 centimeter H2O. So it reverses atelectasis, improves lung compliance and oxygen saturation, and facilitates sputum clearance. So it's given in intubated patients. It's not given to like regular patients. The demerits are it has a risk of barotrauma, discomfort, and anxiety. So now looking at the high frequency chest wall oscillation device, that is HFCWO, we call it VEST. It increases airflow velocity, which creates repetitive cuff-like shear forces and decreases the viscosity of the secretions. It utilizes a mechanical device known as VEST. It's a two-part system. First, the variable air pulse generator, and the second is unstretchable inflatable vest worn by the patient, which creates vibration and air movements. So here basically a full uh, mechanical device is worn by the patient, and then the oscillations are given to the patient, and it stimulates the cuff. This device is nowadays used in ICUs very much for the patients. Now looking at the positive airway pressure therapy. PEP therapy are used to mobilize secretions, reduce air trapping to optimize the delivery of bronchodilators and prevent infection or reverse atelectasis. So there are three type of PEP adjuncts: continuous positive airway pressure, CPAP, expiratory positive airway pressure, that is EPAP, and positive expiratory pressure, that is PEP therapy. So we are going to look into PEP. So PEP devices are most frequently used, and they involve active expiration through a one-way valve against the variable flow resistor. In modern PEP devices, flow resistance can be manipulated to adjust for desired pressure. So I have mentioned 6 devices here. So Acapella, Flutter, everyone would know Acapella and Flutter, but very few or very less would know Aerobica, Quake, Therapep, RC Cornet. So Acapella and Flutter are devices where there are vibrations on expiration. So basically the cuff is removed after the when there are vibrations on expiration. In Aerobica, Quake, they both are OPEP, that is oscillating PEP devices, where there are vibrations or percussive movements on both inspiration and expiration. So these both are new devices which are not that much into India, but people are doing research. Even I am doing one to find out. They have already been proven better than Acapella and Flutter. So they are very much into use now, and the awareness is still being bought. So then there is a Therapep device where expiratory pressure indicator is there, and there's a valved resistor. You can set resistance according to the patient, and you can even get the visual feedback by the expiratory pressure indicator, where the blue pipe rises according to the pressure given. So this is also a new device which is used nowadays. And then there's RC Cornet. So RC Cornet is same as Acapella and Flutter. There are vibrations on expiration only. But then there is RC Cornet Plus, which is into market now, which is a combination therapy. So their integrated nebulizer connection is also attached to the RC Cornet, that is RC Cornet Plus. So these devices have been proved better than the traditional methods. Looking at the recent scenario, researches which are going on, all the PEP devices have been proved very much better and effective than the traditional devices. So now moving to suctioning. It is a mechanical aspiration of pulmonary secretions from a patient with artificial airway in place. Suction is used to clear retained or excessive lower respiratory tract secretions in patients who are unable to do so effectively for themselves. So there are two systems, closed suction system and open suction system. So open suction system is when suction catheter is introduced by disconnecting the patient from ventilator, and when it's introduced, when the catheter is introduced into the ventilatory circuit itself, it's the open suction system. So the oropharyngeal airway suction, that is Gede's airway, OPA, and the nasopharyngeal airway suction, NPA, are used to restore airway patency by separating the tongue from the posterior pharyngeal wall. They help maintain adequate oxygenation through providing an avenue for adequate ventilation. They provide access for the removal of secretions in the upper airway via suctioning. So suction, we know three types, that is oropharyngeal, nasopharyngeal, and one that's through the tracheostomy, that is endo-ETT. So in ETT there is closed and open, and then there are oropharyngeal and nasopharyngeal. So looking at the complications, what all can happen due to BHT? So atelectasis, hypoxia, cardiac arrhythmias, BP fluctuation, increased metabolic demand and oxygen consumption, gastroesophageal reflux, pneumothorax, raised ICP and decreased cerebral oxygenation, and death. Even death can occur if we give BHT without looking at the vitals or even in the contraindicated stage. So these were the complications. These were the references. I've taken everything with reference. Any questions?
Nice presentation, Prachi.
Yes, sir.
Rupesh, are you there?
Yes, sir. Yes, sir. Yes, sir.
Yeah. Is there any questions in the chat box?
No, sir.
Okay.
There is no question.
Prachi, are you sure you would like to take questions?
So,
Prachi, are you sure you would like to take questions?
Yes, sir. Are there any
Okay.
questions, sir?
Yes, yes, yes.
no
there are
questions.
some questions. No questions. Okay. Good. No
Revati
questions at all.
has raised her arm.
Okay.
She has raised her
Revati, can
hand.
speak.
Revati, would you like to speak? Please
Yes, ma'am.
unmute your mic.
Yes, ma'am. Good evening, ma'am. Ma'am,
Yeah,
can you
Yeah, good
please
evening.
repeat the
Very good evening.
indication?
Yes, yes, sure.
Prachi,
So, ma'am, shall I share my screen or I'll just say?
yeah, you can share if you like, or you can say just like that. No problem.
Okay. So talking about the indications of BHT, there are, it's basically used to prevent respiratory complications, treat pulmonary infection. They are used in excessive sputum production. When the patient has excessive sputum production, I told how much is the excessive. That is 25 to 30 ml per day. That is 12 teaspoons. Which is in common pathologies like cystic fibrosis, bronchitis, COPD, bronchiectasis. Then when the patient is not able to cough, that is ineffective cough, that is maybe due to weakness, pain, placement of artificial airway, or when the surgery has been done and the patient is not able to cough properly, that is ineffective cough. So in that cases, you will give BHT. Then there is prophylactic and therapeutic indication. So prophylactic includes preoperative high-risk surgical patients. That is, the patient is going to be in very much pain and his breathing capacity is going to be decreased after the surgery. You give that patients preoperative also. In post-operative patients who are unable to mobilize secretions, and in neuro patients who are unable to cough effectively. So that is prophylactic. And the therapeutic, that is atelectasis, then abnormal patients with abnormal breathing patterns and musculoskeletal deformity. So these are the indications.
Thank you so much, ma'am.
Yeah, thank you so much.
Sure, Rupesh.
Can we
Do you want to
conclude,
read
sir?
out?
Sir, I think there are more questions.
Yeah, you can take other 2 questions and we can
Okay.
go for the next.
Yes, so Asia, the difference between Acapella and Flutter. So the Flutter uses force of gravity, whereas the Acapella doesn't use. And the Acapella has 2 forms, the 2 colors, that is green and blue, which depends on the expiratory capacity that you are having. So in Flutter, the force of gravity is used, while in Acapella it is not used. The magnetic attraction of the device is used. So basically both are PEP devices and generate oscillatory forces, but only the magnetic attraction and the gravity part is different. And can we position the patient for postural drainage on ventilator?